And now to a dramatic first-hand account of what doctors are facing right now. Dr. Craig Spencer was in West Africa during the Ebola outbreak there. He later contracted the virus himself. Well, now he's the director of global health emergency medicine at Columbia University Medical Center in New York. And his tweets yesterday about his life in the ER these last few days and weeks got a lot of notice. Here's one of them. Nearly everyone you see today is the same. We assume everyone is COVID-19. We wear gowns, goggles, and masks at every encounter all day. It's the only way to be safe. Where did all the heart attacks and appendicitis patients go? It's all COVID-19. Dr. Spencer, good morning.
Good morning, Savannah.
I'm so glad to have you here. I'm so glad to have your perspective. You're there. I imagine you're headed to the hospital in a few moments. Take us into what you're seeing right now. I think people see empty streets and they think, what's different? They're not seeing what you see every day.
Yeah, I noticed that the other morning when I was walking to work, the streets were empty. And as soon as I walked in, it was a completely different scenario. Everyone is gowned up in personal protective equipment. I've worked at the same place for 9 years. I know my colleagues, and to see them in goggles and masks, I just don't get used to it. It's really kind of crazy every time that I walk in. And as you mentioned, last week we were looking for the one or two coronavirus patients that might be in the ER. Now it's hard to find one or two patients that are not coronavirus. The increase is absolutely staggering. And we know that we're really at the beginning of this. Case numbers are increasing on a daily basis, and soon our hospitals are going to be overwhelmed.
And what are you seeing? How are these patients presenting? I mean, we know that according to the experts, 80% will have mild and moderate symptoms. You're seeing the most serious cases. Does it run the gamut? Are you seeing younger folks as well as elderly patients?
Yeah, absolutely. We are seeing everyone from every age group. Yeah, it seems like older patients with comorbidities, with things like high blood pressure and diabetes, seem to be hit harder. But some of my sicker patients have been in their 30s or their 40s. Some of the people that we've been putting on their breathing tube, have been my same age. So the burden is certainly on older populations, but it does not spare anyone. And being in your 30s or being in your 40s or really even being in your 20s does not exempt you from having severe complications from coronavirus. So it's important that everyone understands why we're doing this and why social distancing is so important, because without it, we're just going to spread this further in our population from New York to Newark to New Mexico, everywhere around the country.
Are you worried about the amount of ventilators that you have in your hospital, the respirators, the masks, the personal protective equipment? Are you worried there's not enough?
Absolutely. Everyone's worried about that. At the rate that we're putting people on ventilators, at some hospitals 1 to 2 per hour, the simple math shows that it's only a matter of time until we run out. We need more ventilators now. My friends working in emergency rooms all throughout the city are talking about restrictions on the amount of personal protective equipment that they can wear, being asked to reuse N95 respirators. Those are the thicker, more resilient masks that help filter out the virus. And the reason that I've said in many ways this coronavirus pandemic is worse than working in West Africa during Ebola is because I never once worried about my personal protective equipment in West Africa. This virus, unfortunately, is perfect in the sense that it spreads really, really well. It gets all age groups. It's just really scary, the potential this virus has. We've already seen it in China, we've seen it in Italy, we've seen it in New York, and I think we'll see it throughout the rest of the country unless we act now.
I was so struck by your tweet. You said you might hear people saying it isn't real. It is. You might hear people saying it isn't bad. It is. You might hear people saying it can't take you down. It can. I survived Ebola. I fear COVID-19. What's the message you want to say to people who are watching in the few seconds we have left, Doctor?
I think what's important is to take this very seriously. It does not exempt anyone. Everyone can be impacted by this virus. What we're seeing in the emergency room right now is dire. It's only a matter of time before this spills out onto the streets. Please stay home. Please protect yourself. Please protect your healthcare providers. We need everyone to do their part, and we will get through this. It will take some time, but we will be over this just right now. we need everyone's assistance in trying to save as many lives as possible.
Dr. Spencer, thank you for taking a few of your precious moments that you probably want to be with your family to share this message. And please do us a favor and give our love and thanks to everyone you work with at the hospital. We really appreciate it.
I will. Thank you.